A patient who was a police head, big time in police. He said, "Doctor, you had a brain tumor. All I want is somehow make me live till my son gets married." And there was a gentleman who came from Northeast. He brought his grandson. He said, "Doctor, I couldn't bring my son because there's a large tumor in the abdomen. Can I bring him? This is what, if you can make him live for 6 months till my grandson graduates." So we brought him, we blocked all his blood vessels, shrunk the tumor, and later on I got a letter from the father saying, "My son lived through my grandson's graduation and then passed away." That is what life is. We all look at some event in life. As I said, we are not immortals. We are going to leave this world one day, but we cherish being with the family. These are the things I learned from my patients, and this sets the life for us for the future. And I hope this knowledge of oncophilosophy, what I am gained or beginning to gain, is only tip of the iceberg. There is deep dive needs to be done into this, which I am going through, and lot of thoughts, ideas, goodness, I think will come out of it, which in this today's society is very much needed. Hello everyone. Today I am going to be discussing about a subject which is not addressed quite often, and a little bit I call it out of the box thinking. I'm an oncologist. I've been in oncology for 50 years. And when you look at oncology as a field, one always looked at it as a very difficult field, a field where cancer patients are treated. What do cancer patients go through? And the perception has always been in the society is a terrible thing. They go through a lot of pain, suffering. There is no cure. All of this has been there in the past. Through the concept of oncophilosophy, I will try to kind of bring some change in your thinking today. What is oncophilosophy? Why I have coined the word? Being an oncologist for 50 years, an entrepreneur who started HCG, I also sometimes use the word doctorpreneur. Like that, oncophilosophy is also, in my view, a subject which needs a deep dive. While we all have read various great philosophers, from the time immemorial, like Socrates, Plato, Aristotle, and then we have various modern philosophers. But in my view, this philosophy has always been about reading, some observation, but very little of it is own personal experience. So now I am going to take you through, as a doctor, how I perceive what patients are going through and what they are going through, their own story, and based on that, what is this concept of oncophilosophy, and really what is it we can learn from it. We don't have to be a cancer patient to learn. What is it we can learn? So these are some of the thought-provoking ideas I would like to leave with you today at the end of this conversation. But let me take you back to my own journey and my own encounters. The year was 1976. I was in MD Anderson Hospital. I was in my fellowship program, and I had a couple come from Florida. The patient had acute myeloid leukemia. They would travel every few weeks to Houston, and they became somewhat of friends with me. Normally we don't have any go out with patients, have dinner, but because of our friendship, way it evolved, I did go out for dinner a couple of times with them, with beautiful conversations. Here you are sitting with a cancer patient, and particularly at that time there was no definitive treatment for AML. We all knew the patient could die within months, But we were having a conversation about life in general, the philosophy, laughing, giggling, talking about their dogs. Normal talk. Some light lit in me. Wow, what is this? What is this experience I'm doing? Then, of course, the patient passed away after few months, and it was one of the last things he told me was, "Doctor, in the hospital, if only I can be cured, I will write all my wealth to somebody." He was a very wealthy individual. That also struck me. Wow, how it is, how we value life, how we look at life on a very day-to-day basis. Then when I moved to Chicago area, Burlington, one of my first patients was Phyllis. She was about 50 years old. She was told she had advanced cancer, breast cancer, or spread to the bone and elsewhere. So she thought she was so-called terminal. And they told her, this doctor from Houston is coming, joining us, and he'll come and see you. So it was a weekend afternoon. I went to see her. I even remember the room, corner room, 464, I think. So I went to see her, and she was with wide eyes, pale looking, scared. As I started explaining to her how I can get her into remission, how, she can go back to work, her eyes widened. "You mean to say I'm not going to die right away?" I said, "No, Phyllis. Chances are you'll go into remission." Because of my high training at MD Anderson, very aggressive, I knew she'll go into remission. And we'll put you in the remission, you'll do good, but I can't cure. Remission is not cure. So we had a good dialogue about it, and she had a couple of conditions. She said, "I'll go through all the treatment, but I want to go to Colorado for skiing. I want to go to Ireland to visit my ancestor, relatives." I said, all of that can be done. So in the next few years, believe me, she did everything she wanted to do. She used to work at a GE factory. Apart from her work, she traveled across Colorado, did her skiing. She went to Ireland and parts of Europe and really enjoyed her summer there. So in the year 1988 or so, I was frequently coming to India to establish my centers, about 2-3 months a year. One of my trips I was in India, and then I went back. Then they called me on the weekend to say, "Look, Phyllis is not doing good. You should visit her." So normally we don't visit houses, but I said, okay, let me visit, because very, very concerned about her, very close. And she was sitting in the corner coughing. A disease was in the lung. I said, "Tomorrow we'll see about putting you on some new drug. Let us try this." She said, "No, doctor. I just wanted to thank you for the 8 years you have given where I could achieve all the things in my life." See, in life, we all have certain goals. And Phyllis had achieved that goal, she said. She didn't want anything more. And that very night she died, as though she was waiting for me to convey that message. Then there was Jane, who again was about 52 years old. She had extensive disease, breast cancer, and she was also told she may not live long, but she lived for 9 years under my care. And when the disease has spread, her calcium level was high, we knew she may not live through the day. So I went to visit her. It was again on a weekend. Normally there the family comes out. So I went into the room and I saw the blood pressure was 60/0. I knew, but she was quite alert. I knew she may not live long. And I kind of broke down because I'd known her for so many years. You know what she did? She took Kleenex, wiped my eyes. I said, "Dr. Ajai, you have done so much. I've been able to do so many things in the 9 years. Please don't." See, this is what we learn from patients. A patient who is about to leave this world, anytime, consoling her own doctor. What is the message here? To me, to the entire society. We make issues about small things. We fight about things. And here I want to talk a little bit about immortality. We behave as though we are immortal. We behave with arrogance. We behave like, nothing can happen to me. There is a story about immortality where in Mahabharata, the Dharmaraya is asked by Yakshas when he goes to drink water, his brothers have all fainted. Then he says, you have to answer me this Yaksha Prashna. What is it, he says? One of them is, what is the most amazing thing in the world? He says, amazing thing is, we think we're immortal and behave like that, even though we are not. So, that message conveys to us, each day is a new day. Positivity is important. Nobody is immortal. A lot of civilizations have come and gone. Great civilizations, Indian civilization, Harappa, Mohenjo-daro, Greek civilization. Then you have Roman civilization, Hindu Gupta civilization. All of that has come and gone. And so many people, have come and gone. We are insignificant in this world. Some of the light rays have not even reached Earth from distant stars. So even a blink, we don't even, in the whole scheme of things, we don't even live as a blink of an eyelid. But we think we are forever. The greed, the way we want to look at money, power, and the way we do bribery, the way we behave with, some of them, with nothing but arrogance, cheating. When you look at all this, you wonder, is it really all needed? Like I said in my last podcast, contentment. Here is a guy who works in a railway station or a airport who content with 400 rupees a day, sleeps there. Is that what we want? Or we want to find a definite purpose in life where we pursue that and we find contentment. See, Oncophilosophy is something which gives you that thinking. Compared to the great philosophers' teachings, it is not a teaching. It is a practical learning. You see people doing it. You see people behaving like that. You see people actually performing. It is not acting. It is real life story of these people. When you see it, it just gets to you. Man, what is it I can learn from this? No textbooks can teach you. No philosophers talking can do. But this is practical. So as an oncologist, I feel I have learned a lot. So when I see my patients, I tell them, look, while I am giving you advice, while I am telling you what to do for your cancer, do you know I am learning a lot from this conversation? I am probably getting more from you than what I am giving. They are surprised and shocked. What do you mean? Because these are the things I learned from my patients. And this sets the life for us for the future. And I hope this knowledge of oncophilosophy, what I am gained or beginning to gain, is only tip of the iceberg. There is deep dive needs to be done into this, which I am going through. And lot of thoughts, ideas, goodness, I think will come out of it, which in this today's society is very much needed. Today there is negativism, accusations all over. We are not the same we were even 50 years ago. Rapidly it is changing, but we have to bring about oneness, team spirit, love, affection to all, and positivity. Like I said, glass half full. We have to bring it, we have to introspect, we have to reflect in order to make this change. And believe me, cancer patients are outstanding example for us. Take for example a patient who was a police head, big time in police. He said, doctor, he had a brain tumor. All I want is somehow make me live till my son gets married. And there was a gentleman who came from Northeast. He brought his grandson. He said, "Doctor, I couldn't bring my son because there's a large tumor in the abdomen. Can I bring him? This is what, if you can make him live for 6 months till my grandson graduates." So we brought him, we blocked all his blood vessels, shrunk the tumor, and later on I got a letter from the father saying, "My son lived through my grandson's graduation and then passed away." That is what life is. We all look at some event in life. As I said, we are not immortals. We are going to leave this world one day, but we cherish being with the family. Like one of my patients told me, very touching. She came as though she was told she is terminal. She had a tumor, tonsil, which was going into the brain. She was told, "Go on morphine, nothing can be done." Of course, my clinic is advanced recurrent tumor. I took the patient, really took care of her like she's my sister. Lot of things we did. She lived for 5 years, and the family would write to me, "Every day we have dinner, we think of you, because one more day with my sister or mother." See, that is life. That, in my view, is Oncophilosophy, what we can learn. I hope this message goes across not only to oncologists, to other doctors, not only to cancer patients, to all others in the society. So in the end, we become really a winner to take this challenge of life, and how we can be productive, how we can have fun, how we can really be a positive approach to the life, not only contribute, but enjoy and cherish each day. Thank you.